Thank you. Ms. Pryor.
So I too commend you. It's a great piece of research and effort, and really to the health department staff and you, Dr. Farley, I think this is a terrific thing. And it's hard to do. There's a lot of unhappy people, and but I think your point is well taken that over time it does become the new norm. And I'm not a doctor, and I see a lot of patients in this big hospital that I run in a very, in pretty much a low-income, working-class neighborhood, and we understand all of the public health effects of behavior that's not really good for you that end up having really bad impact on people who come into the hospital. Sorry to be so inarticulate here. And I think that it's true that public health measures taken and made easy for citizens to follow by promulgating regulations ends up in the end being something equally as significant as what we do in hospitals to cure people. So I wholeheartedly support this effort.
Thank you. Dr. Gillette.
So thank you for,
in terms of addressing this particular proposal, I think it's very important that we approve it and move it forward as one piece of a larger plan to address what really is truly an epidemic in the city. Thank you.
Thank you very much. I don't hear other people, see other people asking to make comments. Do I hear a motion?
Yes, so moved.
Okay, do I hear a second? Okay. All in favor of approving the proposal?
Aye.
Aye.
Opposed? Okay, abstentions? One abstention. So have we got the recording of that vote? Let me just say, I really want to thank and congratulate the board for two things. First, for spending the time to review these comments and think about this in a scientific way. Many of you pointed out how many hours you spent doing that, and I have no doubt that is many hours, and I know you have many other responsibilities, so I appreciate that. I also want to congratulate the board on taking what I consider to be a historic step to address a major health problem of our time. I also want to congratulate the board on taking what I consider to be a historic step to address a major health problem of our time. This body, over the last 150 years, has addressed health problems of the day in many areas, ranging from cholera to tuberculosis to lead in paint to trans fat. Many of those decisions were controversial at the time, but in retrospect are widely accepted and effective. And I feel that this decision today will be just as significant as those past decisions, and in the end will be just as effective. Thank you very much.